Bullying at work. Insertion. The insult colloquially is understood by colleagues or supervisors at the operating position under bullying at work. Bullying at work is a concept, negative communicative actions which are aimed at a person and describe the relation between perpetrator and victims to be described because it very often occurs over a longer time period. These usually have the destination that the person affected gives up the operating position. Among other things, bullying at work leads sleeplessnesses and/or depressions to nonspecific somatic and emotional perturbations and complaints. Sensitiveness. What is bullying at work? Concept: bullying at work being from English with this angle to mob molests, attack, fall upon somebody. 4. 1 marked systematic and continual intrigues, harassments, defamation of character and psychological intimidation in organizations, particularly at the operating position. According to estimations, are affected by it between 300,000 and 2.5 million people in Germany. Bullying at work can take place under colleagues or between supervisors and subordinates. The inferior person is directly or indirectly attacked with the destination of the output. Among other things, a whole series of behaviors which are typical of bullying at work gives marking off, discrimination, distribution of rumors, permanent criticism, insults, and this withhold of work-relevant information. Bullying at work behavior can also immediately aim at the field or the health of the victim, for example by threat or exercise of force or in the form of indecent assault. Though bullying at work has far-reaching negative effects on the health and the professional or private situation of the victim. The systematic hostile attacks at the operating position lead to faint feelings and strong uncertainty with the persons affected, demotivation, performance and thinking blockades, doubt about the abilities of one's own, states of panic, lack of concentration, inner notice, and depression can be the consequence. Also, physical complaints, for example high blood pressure, heartaches, migraine, sleeplessnesses, frequently occur. Therapeutical treatment possibilities. The behavior therapeutical psychotherapy of persons affected includes both the physical state of health and the emotional difficulties common with the patient analyzed, which one will pass cohesions between the symptoms and the behavior and define corresponding treatment objectives. The setup can such a destination be self-confidence is, for example, once more, in the context of an assertiveness training, the thoughts, feelings and behaviors of the particular are investigated in stress and conflict situations, the taking place explained and worked on mastering strategies by bullying at work actions. In cognitive behavior therapeutical conversations, both the depression and the family and social problems resulting from the bullying at work are treated. It can make sense if the reference person of the patient, approximately the partner, also takes part in the therapy. Different unstressing techniques contribute motion and design therapy to the stress reduction and therefore also can support the healing process.